Good evening, everyone. Thank you for joining us tonight. My name is Noah. I am the director of Project Lyme, and we have an amazing presenter tonight, Dr. Adrian Baranchuk, who will be presenting on the diagnosis and treatment of Lyme carditis. Dr. Baranchuk is an expert on this topic. He has been working in the space of cardiological medicine for decades at this point. So we're really lucky to have him as a presenter this evening. He will be, as I mentioned, presenting on this topic, going through the presentation that you see in front of you. And then following that, we will be opening up to a Q&A session. For anybody who might have a question throughout the presentation, I invite you to add it into the Q&A section at the bottom of your screen. We will go through the presentation first and then address all questions afterwards. So I would really appreciate if you would do that. It would make our lives a lot more smooth and simple as we go through this process. But at this point, I'll go ahead and turn it over to Dr. Baranchuk, who is going to give you a great presentation this evening. Thank you so much for being here, Dr. Baranchuk.
Thank you, Noah. Thank you for the invitation and the opportunity to be talking for all the followers of Project Lyme and ILADS, the International Lyme and Associated Diseases Society. It is a true pleasure to have this opportunity to share with all of you what do we know and where we want to go with knowledge about Lyme carditis and discussing an effective diagnosis and treatment. So thank you very much for this opportunity. These are my disclosures. And even when I say I have no conflict of interest to report because we don't get paid for this type of job, I do have a disclosure. I truly enjoy seeing how Project Lyme and ILADS are expanding knowledge and reaching different communities in order to have our people better educated on Lyme disease and discussing prevention and discussing how to access care if Lyme is generating a problem in your health. So thank you very much for that. And finally, please remember, I'm a cardiologist, electrophysiologist. We are the electricians of the heart. I am not an expert in infectious diseases. And my involvement with Lyme carditis was quite gradual as being exposed to several cases and living in an endemic region. But there may be some specific questions that I may not be the right person to answer. Having said that, I would like to navigate you through a brief review of Lyme carditis and then to focus on what are the challenges, which is basically how to spread education, what to teach, and this is what we are going to discuss today, an effective algorithm for diagnosis and treatment of Lyme carditis, and what aspects we still need more research to be sure that the actions we're taking are supported in an evidence-based medicine. As you may know, Lyme disease has 3 big stages that can be separated by months as the early localized versus the early disseminated, or by years or even decades between an early disseminated Lyme disease and a late disseminated Lyme disease. So where is Lyme carditis in all this? It is in the early disseminated phase, and that can be weeks or even few months after what we call the primo infection, after you've been bitten by a tick. And then after moving through the early localized, sometimes with a rash, sometimes not, I will show you the percentages, and having all the classic specific symptoms of this type of infection, within the first 2 to 3 months, you may present with early disseminated Lyme disease affecting the heart, and that is what we call Lyme carditis. And Lyme carditis can affect the electricity of the heart, just the electrical system of the heart, or it can affect the different walls of the heart, and that is what we call myopericarditis, when all the layers of the wall of the heart are inflamed due to an excessive immunological reaction to the bacteria. And that can produce fainting, shortness of breath, palpitations, chest pain. All those symptoms may be manifestations of early disseminated Lyme carditis. You may have been diagnosed and treated, or you may not. And then there is a late disseminated Lyme disease component where the heart at the beginning was not involved. However, today we have enough data to support that if your Lyme disease was undiagnosed or poorly treated, or even more, your Lyme carditis was undiagnosed or poorly treated, you may evolve with a chronic form of cardiomyopathy associated with Lyme. I'm going to talk briefly about that at the end of my presentation. And as you know, I don't need to tell you how is the diagnosis and how difficult it is for some doctors to do the diagnosis of Lyme disease, because that mimics many other type of infections. This classic bullseye rash is present only in 30 to 40% of the people. I will show you one of our cases of Lyme carditis where the rash was absolutely nothing to do with this classic presentation. And what do we know about Lyme carditis? Is that these bacteria can affect the different layers of the heart. That is more common in males than in female. We are deeply studying why is this difference. Is it because there is a genetic hormone concept behind it, or is it simple because historically men were more exposed to tick bites because the type of jobs that are done in the outdoors? It is not until recent that we are reaching some degree of gender equity in the type of jobs. But for decades, men were the guys doing the roofs on a cottage, or the military service personnel, etc., where there were way more male exposed to tick bites than female. How frequent in patients with Lyme disease is to have Lyme carditis? When you see, including our work, you will find a reference of 4 to 10%. It's quite high. However, this is a report of those patients that presented with Lyme disease, classic Lyme disease, were deeply investigated for a heart component by means of specific interrogation on cardiovascular symptoms in one side and a simple, cheap, highly reproducible electrocardiogram on the other. Why is that? Because as Lyme disease could occur in very young individuals are quite resistant to cardiovascular changes. They may not have symptoms, and if you don't interrogate and do an ECG to prove that that was normal, we may be missing some Lyme carditis that are being poorly treated because they are only treated as Lyme disease for 1 week, rather than the 3 weeks that we advocate for Lyme carditis. So please take this 4 to 10% with a grain of salt. And the clinical manifestations, it can happen that the electrical system gets interrupted. So all of a sudden you are beating at 60, 70, 80 beats per minute. Now you're beating at 20, 30 beats per minute. And that can produce fainting or excessive dizziness and lightheadedness, or shortness of breath, palpitations, chest pain. Why? Because you're expulsing less blood than what you're supposed to do. So I am questioning that 4 to 10%, if we systematically study the cardiovascular system by a simple ECG in every person with suspicious diagnosis or confirmed diagnosis of Lyme disease, this prevalence may be higher. We keep moving. Our first contribution, our first 5 patients, all of them presented with high degree AB block, interruption of the electrical system of the heart. What is the treatment for that if this is not Lyme disease? To put a pacemaker. But in Lyme disease, if you do the diagnosis quickly, if you start treating the patient with IV antibiotics, the conduction system may recover in 5 to 10 days. And then the pacemaker may not be needed. And in our initial series, look at the ages, how young these people were. You know what it means for a 14-year-old kid to live with a pacemaker for the rest of their lives. It can be quite challenging. Well, in this population, no pacemaker was implanted. And do we know how these people did over time? Well, with the help of one of our students at that time, now she's in London, Ontario, we did a follow-up up to 21 months of 7 individuals. What did we find? No one required a pacemaker, all of them doing their normal lives. However, they have changed the way that they protect themselves when they are in the outdoors. They learned the lesson. 5 topics, we published these, 6 years ago. Lyme carditis may be an early manifestation of Lyme disease. A diagnosis of Lyme carditis should be considered when young individuals present with severe electrical problems of the heart, which is a disease of adults or elderly individuals, not of young individuals. The atrioventricular block, which is the complete interruption of the electricity, can progress very rapidly and be fatal. And this is why some of the people that we admit with Lyme carditis receive something called a temporary permanent pacemaker. Until the antibiotic makes effect, the conduction system improves, and we have strict measurements on at what time we can remove that temporary permanent pacemaker and send the patient home. I'm going to show it to you in the next few slides. Early treatment with antibiotics, and for a total of 3 weeks between the IV and the PO antibiotics, can reverse the condition in Lyme carditis, and you may not need to implant a pacemaker. So before considering implanting a pacemaker, please think in all of this. And I'm going to show you a couple of cases where the pacemaker was implanted, the patient was properly treated, and what did we do? We proceed to remove the permanent pacemakers. I will see you at the end. I will show you at the end of the presentation. So this is the famous now, I'm very proud of that, SILC score, Suspicious Index in Lyme Carditis, SILC. And that uses an acronym called COSTAR that was created by one of my fellows. Then you live in an endemic region for Lyme disease. A young individual presents with high degree AV block, which is a serious electrical condition. If you want to determine what is the probability of this patient having Lyme carditis versus other type of problems, run the COSTAR. If the patient has constitutional symptoms, fever, malaise, feeling unwell, lack of appetite, lack of energy, you get 2 points. Doing activities in the outdoor, point. Sex male, 1 point. If the patient recollects a tick bite or removing a tick from any part of the body, 3 points. If you have age less than 50, 1 point. And if you have a rash, any kind of rash, you get 4 points. And look what happens. When you have 7 to 12 is a high silk, 3 to 6 intermediate silk, 0 to 2 is a low silk. If you have 0 to 2 points in the silk, put a pacemaker because this is not Lyme carditis. You can even ask for serology, but it's gonna be negative. But from 3 to 12, you should consider sending serology and start rapid treatment with IV ceftriaxone, because this patient may recover without the need of having a pacemaker for the rest of their lives. And this is why at that point with Cynthia was an internal medicine resident, now she's doing oncology in Vancouver, we published in JACC this algorithm that now is also used by the CDC. And this algorithm tells you the following: how to diagnose and manage Lyme carditis. If a patient presents to you with a high degree atrioventricular block, and it's not a classic 78-year-old gentleman, that the atrioventricular block is not due to Lyme, is due to aging, run the SILC score. Here is the COSTAR variables. If you get 0 to 2 points, the chances of this being Lyme carditis is low. Proceed with a standard treatment, which in this case is to put a pacemaker. But if you have intermediate or high, get a sample, order a serology, and start antibiotics empirically. In addition to that, if the patient has a very low cardiac rhythm, you have to admit the patient in a unit where a monitor can be connected 100% of the time. If the patient has a low cardiac heart rate, but it's completely asymptomatic, you can do monitoring, waiting for the antibiotic to act at the level of the heart for the conduction to improve. But if the patient is dizzy, lightheaded, or have fainted, or even require CPR, then you have to put a temporary permanent pacemaker, which is something that has been described for other conditions, and we adjusted to Lyme. And why is that? Because this is young people, and with a temp perm rather than an only temp, the patient can deambulate right after the implant. And in my center, to prove this to my team, we put the first temp perm in a Lyme disease individual, and I asked the patient from the table to walk to the unit. So the patients can deambulate quite early. Then you receive the serology. In our place, it takes 4 to 5 days. In some places in the US, take only a few hours. Two things can happen. Serology is positive, you have confirmed that, so you are going to continue the IV treatment for at least 7 to 10 days, sometimes 2 weeks. When the conduction reassumes and now the upper and the lower chambers are contracting in a synchronized manner, is when you can move the antibiotic to PO, remove the temp perm, and plan for discharging the patient. However, even if your patient starts improving, the serology is negative, and we know that the 2-tier is not the perfect test, but if the serology is negative, you are not able to confirm that what is happening is Lyme disease. So far, this happens to us only once, where the patient received the antibiotic treatment, improved, but the serology was negative. Two options. Option 1, the test is not perfect and the false negatives exist. It could be that. Option 2, the patient did have a co-infection, but not by Borrelia, maybe by Babesia, by another germ that responded to antibiotic, but the test for Borrelia was negative. Only one case. So if the conduction reassumed during the first 10, 14 days, the patient can do a stress test before going home, and depending on the response, going home and being seen at 4 to 6 weeks. However, if despite all our efforts, the conduction does not resume, the patient needs a pacemaker. So far, no patient has fallen into this category. Now you do a stress test, and look at this. I'm going to make it simple. If you can go with normal conduction above 120 beats per minute, you come to my office to see me in 4 to 6 weeks with another ECG, so I can compare the ECG at discharge and the ECG 6 weeks later. If you are between 90 and 120 beats per minute and the conduction starts failing, I want to see you at 4 to 6 weeks, but with one more stress test to see if the conduction improved over time. However, if there is a defect of conduction below 90 beats per minute, you need to recommend a pacemaker. However, so far, in our experience that now is a little bit less than 40 patients, this never happened so far. It happened, most of them that are seen at 4 to 6 weeks, and a couple of them where we repeated the stress test. In summary, the patient is being tick. A couple of months later, high degree atrioventricular block, application of the silk score, of the algorithm, patients are properly treated and are discharged home without having to have a pacemaker implanted. And all of them complete a total of 3 weeks of antibiotics. Now look at this. Pacemaker implantation in patients with Lyme carditis. I had 2 patients that in different hospitals were admitted. They suspected Lyme carditis. However, they sent to a third place the patient to have a pacemaker. Then they heard that there was this guy in Kingston, Ontario, and I had the opportunity to see them within the year of having the device implanted. Explanting a pacemaker, a permanent pacemaker, is not complication-free. And after 1 year of implant, it has to do under strict circumstances with special extractors. I would not recommend after 1 year to remove a patient that was diagnosed with Lyme carditis. But in these 2 cases, the patients receive the pacemaker early and receive full antibiotic treatment. And I've seen one at 3 months of the implant and the other one at 4 months and a half of the implant. We checked the pacemaker and the pacemaker was not being used. In one case, 0%, in another case, less than 1%, only at night when the rate of the patient was too low. We discussed with the patients the pros and cons of living with a pacemaker for the rest of their lives versus the risk of extraction. They both underwent extraction. They are doing normal lives without pacemakers implanted. A case that, look at that, silk score is 8. It is high, but in the lower rank of high. Why? More than 50 and woman. Look at the rash that the patient presented. She took her own picture. That is not a bullseye. However, look at the ECG, how slow each one of these peaks are indicating the rate. The less peaks you see, the lower the rate. And in the bottom, you see the stress test pre-discharge being completely normal. This individual is doing her normal life. This was published in 2024, so it's almost 5 to 6 years since her case got resolved. This is to show you the paper where we start using the temporary permanent pacemaker. The patient comes with a very high degree AV block. We put this is the normal ECG at discharge. And this allows the patient that may need to be admitted sometimes for 7, 10, 14 days to be walking in the corridor of the hospital rather than attached to a bed, thinking a 27-year-old, as in this case, 10 days without moving from bed because the temporary pacemaker could be displaced. With a temp perm, the patient can deambulate earlier. And this is, I'm going to go quickly so we leave, I see lots of questions in the chat, thank you, that we have systematically reviewed every single aspect of the disseminated Lyme disease and dilated cardiomyopathy. That means the late stage of Lyme disease. It's very, extremely difficult, even with all this body of literature, to be 100% sure that a patient with a dilated heart where the pumping is quite low, that is the consequence of something that happened 20 years ago, and not that something that happens during the last 5 to 7 years that has nothing to do with Lyme. So still a big area for discussion and thinking. Very quickly to show you that the famous sick sinus syndrome can occur. This is a very young individual, can occur in patients undergoing Lyme Carditis. This is one of our med students helping with this case. And as you can see here, you see this long process, then the stress test of the patient being completely normal, then at 4 to 6 weeks, the completely normalized ECG. So the more we teach, the more we discuss, the more we learn. Finally, to show you that in order to develop the model of Lyme disease affecting the heart and Lyme carditis and the long consequences after decades of poorly treated or undiagnosed Lyme disease, how Lyme can affect the heart, used a model of a very prevalent disease in Latin America from Mexico to Argentina, which is Chagas disease. And that allowed us to create models for Lyme that are using pre-existing knowledge in other infections. And this is why we question ourselves now that we learn aspects of Lyme. Should we learn the same, or not learn, but create models with this highly prevalent condition as COVID? Everybody's talking about long COVID. And when you see the manifestations of long COVID, they are strictly similar to the manifestations of long Lyme. So we can use models from other conditions to continue growing knowledge about Lyme disease. And this is the CDC page on Lyme. I am happy that now they have a page on Lyme carditis. and I am honored that they are using part of our background. So this is a little bit of self-propaganda, Noah. This is our recent book released a couple of months ago with two of our permanent collaborators in the world of Lyme, Dr. Wombold and Dr. Wong. So get a picture of your screen so you know how to get into the Lyme Carditis book. Thank you so much, and I am happy to answer as many questions as possible.
Awesome. Thank you so much, Dr. Baranchuk. I think that was a great presentation, and I clearly have 26 questions, it looks like, in the Q&A here. I do want to just let everyone know it's possible that I might not be able to answer all of your questions. If there's anything specific to your individual situation where you might be talking to a provider, those type of questions we're not allowed to answer on this, type of presentation. You'll have to work with your doctor directly. But I'll just go ahead and work down the list here. And I'll start with the first one. I never have heard anybody labeling heart palpitations experienced by people with Lyme as AFib. I now have occasional AFib that gets better when I treat with the Cowden protocol. There's no specific question, but I guess what they're trying to see is AFib related to Lyme?
I am not sure what link Alicia did between my presentation and me labeling palpitations as atrial fibrillation. Palpitations associated with Lyme can be rapid rhythms or can be slow rhythms, because slow rhythms are perceived as palpitations as well. So are there reports of AFib in patients with Lyme carditis? Yes, but remember that AFib is multifactorial. So depending on other conditions, hypertension, sleep apnea, stress, lack of sleep, alcohol, all triggers of atrial fibrillation, but certainly palpitations in Lyme does not require an immediate diagnosis of AFib.
Awesome. Thank you.
I think I also answered Joyce Stevens' question.
Yeah, I was going to say, I see you're here in the Q&A right there with me, so I think that's going to make my job even easier. I appreciate that, Dr. Baranchuk. Adrian, as you prefer to be called. But so I'll move down here to anonymous attendee. Extra heartbeats and arrhythmia showing on a physical exam and ECGs many years into a missed chronic Lyme illness. Is it common with Lyme carditis, later cardiac presentations years into the illness, and any comments or advice on how to approach seeking further medical help?
So what I could say is that any sort of arrhythmia at certain age is a quite common presentation. Our clinics are saturated of people with palpitations that comes with premature ventricular contractions, which are contractions of the lower chamber, contractions of the upper chamber, is called premature atrial contractions, and different type of rhythm disturbances. The fact that you had Lyme disease when you were young is not a guarantee that those palpitations and those alterations of the cardiac rhythm are necessarily associated with Lyme disease. It remains as a possibility, but my best advice is something that apparently this individual is already doing, which is seeking help from a cardiologist. Some of the alterations of the cardiac rhythm do require treatment. Some of them may require only reassurance that the person has a normal structural heart, and these extra beats are not enough to justify any specific treatment. So my piece of advice could be give it a shot to your cardiologist.
Great advice there. It looks like we have Melody. She provides a very specific outline of a patient presentation. Are you comfortable answering this question?
I am reading as we speak. First degree heart block, ER recommended ceftriaxone idea upon admission. So Melody, this idea is to try to go into global questions because there's 46 individuals, and not for me to challenge what others have done, because there is a liability associated with that. And I hope you understand that I can answer global questions, but I cannot go into the criticism of specific colleagues that maybe they have done their best to the best of their capacity. I hope you understand that, but there are some aspects of your question that are very, very specific, and I am not feeling absolutely comfortable in answering, even when I have my own opinion, okay?
Yeah, I think that's probably the best course with any questions like that. That's why I did pre-state it, earlier, is that it puts us in a place as an organization that's a nonprofit that's here to educate, as we can't speak on individual patient cases. So thank you for
I'm sure she
attending,
will
Melody, and
understand.
your question. Yeah, and yeah, I hope you understand. So we'll move on from there. Is it
The next
feasible?
one is a good one.
Awesome, awesome. Is it feasible that a left bundle branch block, that's almost a mouthful there, is a symptom result of Lyme carditis?
Okay, the only correction for the question to be great is left bundle branch block is not a symptom. It is a conduction disorder that most of the times may be asymptomatic. When I said at the beginning, let's do ECG systematically to all patients with Lyme disease, is because we know that left bundle can occur and could be asymptomatic. However, you bring me a 12-year-old kid that had Ebola, all the symptoms of Lyme disease, and has left bundle branch block. This kid should receive full treatment for Lyme carditis, because if this kid never had any heart problems, this could be a consequence of Lyme disease. And if you treat that properly and the left bundle disappears, this kid may end up with no sequelae from Lyme carditis. So excellent question. In our series of publications, you will find a right bundle branch block as well.
So this next question is very interesting, especially given some information I know about chronic Lyme disease. Why is the incidence higher in men versus women? Women's health concerns are often downplayed or ignored. Before you answer, one thing I wanted to add into that is that actually in chronic Lyme patients, it is more likely that women are seen as chronic patients. That's a statistic that I've seen. So it is interesting that, given the higher presentation in chronic Lyme, why is there a higher presentation of carditis in men? And you might have an answer or might not.
Well, one thing that I love to say is sometimes the questions are much better than the answers. So I am sad that this anonymous attendee didn't put the name, because it's a great question and a question that we are studying at the moment. We are doing a systematic review on gender and Lyme carditis, because the report is constant, 3-1, 4-1, 3-1, 4-1. However, is there a biological condition, a genetic condition, a hormone condition, or this is a representation, as Noah suggested, and I never discussed this topic with Noah before, I promise, that there may be a historical issue on what men and women used to do with their lives. So today, in my university, 60% of med students first year are women. And you have no idea how proud I am of being able to say that. However, you check 10 years ago, and it was less than 20%. And now, if we think in jobs that occur in the outdoors, the same thing applies for many jobs. Military service, that they do this running in the trails and the hacking and all that stuff. The balance between men and women goes in favor of men. Working on a roof, men. Correcting the antenna of TV, men. Firefighters, men. Until we reach that gender equity, there will be some extra exposure from men to areas where the encounter with infected ticks are more often than in female. However, I leave an interrogation mark, and maybe Noah invites me next year to do another talk, and this anonymous attendee reveals and says, I was the person doing that question that time. What do we know now, Dr. Baranchak? Because I want to learn more. I want to be sure if my hypothesis that this could be a historical social issue of more exposure in men than in women is really true, or there is a biological component that makes men more prone to to encounters with infected ticks, or if Noah is right, that in the family doctors and the ERs, we pay more attention to symptoms from men than from women. That is something that different societies, I have the opportunity to be the president of the Inter-American Society of Cardiology, we are working very hard because we know that female present with same degree of symptoms and cardiovascular disease than men, that those differences can be how the same doctors perceive the symptoms in the initial encounters. So if I label a female as hysterical because it has chest pain, I may be missing an infarct. Can this concept be applied to Lyme? Yes, of course. Of course.
Very, very interesting. Let's move on because there's a lot of questions coming in. I want to reiterate to everybody, I appreciate all the questions. It is quite possible that we won't be able to get to them all. I do see one here. Michelle Green is asking, how can they find a Lyme literate cardiologist? One thing I will mention that Project Lyme offers on our website is a provider search. I will create a brief disclaimer, which you can read more on there, is that we don't directly endorse any of these doctors. The information that's provided on this search has been submitted by patients, partner organizations, advocates from all across the country of individuals that are known to treat tick-borne disease. So, and it's also broken down by zip code. So there might be somebody who's considered, such as Dr. Baranchuk, a Lyme literate cardiologist, but obviously he's in Canada. So if you live in Arizona, it might not be a great fit for you, just as an FYI. But I put that in the chat. Actually, let me put it back in the chat. I did not send it to everyone. So I just put that in the chat. If anybody has interest in checking out and seeing what doctors might be out there, that's a list. We have almost 400 doctors on the list. So it might be somebody in your area that could fit with what your needs are. But again, it's not an end-all be-all list. We encourage you to do your own research, and we're not directly affiliated with any of the doctors. Let's see. All right, we'll go back to Georgia here. Although largely in the AV block, is it not possible for interruption in the bundle branches? They appear to present with the same symptoms.
I lost it. I think it's above Georgia, Turkey, although largely in the is it not was interrupted, but I think I answered that. Yes. They can present with the same symptoms, or they can be asymptomatic, Georgia. You may have right bundle branch block, not feeling anything, and if we don't do systematic ECGs to everybody, we may miss some of them.
Awesome. That was a great, quick answer. We'll move on. Mariana, if not addressed during the presentation, how is Lyme carditis treated with allergies to all medications, antibiotics caused by Lyme?
Mirjana, I am a cardiologist. I apologize. If you are allergic to IV ceftriaxone, I do call ID to seek for the best possible antibiotic. It did happen to me several times in other conditions, not with the Lyme carditis that I had to treat, but I have to pass on this answer. I'm sorry.
Sounds good. We'll move on. Anonymous attendee, could you explain the various heart blocks or electrical problems in layman's terms to help patients identify if they may have one of the presentations of Lyme carditis?
The question is good. However, the only way to determine if you have any sort of electrical problem is with an ECG, not taking the pulse. Taking the pulse, you can have an approximation, and you may say, Doc, listen, I have Lyme disease, but I am at 25 beats per minute. Can you take my pulse and reconfirm that? But what the electrical problem is, the only way to know is doing an ECG. So in lay terms, you're not feeling well, you're experiencing Lyme, you have dizziness, palpitation, tell your doctor, I think I need an ECG. And you have to help me getting an ECG. Do you have an ECG in your office? Should I go to the ER? Oh, you don't have an ECG machine here? I'm going to the ER.
That's a great point.
You need an ECG if you're not feeling well in the context of Lyme disease.
Yeah, I think your point also breaks down to the basic of what a lot of patients should do, which is advocate for themselves. You know, even if you don't feel great and you feel, like you said, a heart palpitation or any other related symptoms of an illness, you need to advocate on behalf of yourself to ensure that your doctor is giving you the right care, because as Adrian pointed out, it's possible that somebody might miss it just because they are overlooking it, don't have personal experience. So one thing that I always want people to take away from our webinars is advocate for yourself. So definitely encourage you all to do that. Yes.
Do the same risk of Lyme carditis apply as a result of Babesia? I'm not an expert on Babesia. We suspected this in one case. I have not diagnosed myself a single Babesia carditis yet. So the answer is I'm not sure. The next one is, will this also cover Lyme pericarditis? That is a very good question. So yes, when I say myopericarditis, I refer to the different layers of the heart, the endocardium, the myocardium, the epicardium, and the sac that involves the heart, that is the pericardium. So that applies to Lyme pericarditis. I have not seen a single case of pure Lyme pericarditis, but unfortunately, I had cases of myopericarditis, and I have been consulted emergently by people dealing with fatal cases of Lyme myopericarditis. You may recall one of our colleagues that required heart transplantation, and after that experience of getting a new heart because of Lyme carditis presented with a myopericarditis, he dedicated the rest of his life to spread out knowledge about Lyme disease. Unfortunately, he passed, but it was a great example of how a change in your life may modify so many other lives.
The next one is, and I'm not sure if you'll be able to answer this. Please describe how you manage the treatment of Borrelia versus Babesia, assuming the patient is diagnosed with both.
I do call my colleagues of infectious diseases from the perspective, as I didn't have the opportunity to have this case, I could say I could go with the same management of Lyme carditis alone, but bring in an expert in infectious diseases to contribute to alternative antibiotics, addition of antibiotics, or duration of antibiotics. One of the things that I can do for you to trust in what I say is, when I don't know, to say I don't know.
I think that's a great point, and actually a perfect segue into the next one. One of the people asked if they're aware of cardiologists in Ireland, Europe, UK. As I mentioned, we have a provider search, but unfortunately our provider search is restricted to US-based practitioners. So unfortunately, for anybody who is based in Europe, there's not much that Project Lyme has to offer you in terms of provider resources, but we obviously have a lot to offer from the educational side. So we hope you continue to engage with us. But unfortunately, I cannot offer any doctors or resources related to doctors in Europe at this time.
And the answer is yes. Lots of research come from Europe, specifically from Ireland. And Poland is another country that is deeply affected. And I am in relationship with the Polish doctors, but I know that there are doctors in the UK, and there is a UK Lyme NGO that could be approached, searched via Google, and I'm pretty sure that they could be in a better position than the two of us to advise you on who to see.
Awesome, thank you. I think
the next one is a very good question. Babesia is treated with antiparasitic medications, not antibiotics. That is definitely outside the range of my knowledge, and I thank you for the comment, but that is not an area that I feel comfortable helping.
That's what I was about to say prior to you answering. Okay, we'll move on here. I did just want to let everyone know we'll likely finish up here around 6:30, so another 15 minutes or so, just a conversation, if that's okay with you, Adrian. So again, we might not be able to get to everyone, but we're moving down the list. Next up is Alana Bradshaw. Would the symptoms of Lyme carditis and carditis associated with Babesia be the same, or would they present differently?
There's very few reports. Possibly in the same way, but I'm not 100% sure.
That's kind of what I figured.
Very nice. The following question, very nice. Does a CT angiogram diagnose Lyme carditis? Definitely not. It's not part of the studies that are required. When you are not sure if the heart block is due to Lyme, part of the investigations may include a CT angiogram to be sure that that heart block is not originated in blockages in your coronary arteries. But if you are oriented, you have a high silk score, you have a positive serology, no, CT angiogram is not part of the business. What you can adapt, if there is access and resources, is a cardiac MRI that will allow you to see if there is permanent inflammation in the layers of the heart in addition to the heart block.
Is there always a degree of heart block? Is tech? I actually could you pronounce that for me? I'm not 100% sure how to say that.
It's tachycardia.
Tachycardia.
Symptom, 170, 180 several times daily. Yes, this has been described. I did not have a single case of that. When you are at 170, 180, the most common, not always, but the most common arrhythmia is atrial fibrillation. So if you are presenting with tachycardias at this rate, Kearney, and this has not been seen by a doctor, what I could suggest is that you contact a doctor that will do some sort of monitoring. That can be a Holter, can be an event recorder. It can be using a smartwatch if you're using one. But the first thing that I could say is put a name to a tachycardia at 170, 180 several times a day. Put a name on it before thinking Lyme disease. Let's be sure what is that, because that is not normal. And once you know what is that, your doctor can determine whether it's necessary or not to rule out Lyme disease or Lyme carditis into this context.
The next one is from Daniel. Hey, Daniel, I saw you just sent me a text, actually. Can frequent ectopic beats be Lyme carditis? They will go away when antibiotics are present and then come back shortly after the use of antibiotics.
So, Daniel, Lyme carditis is treated with antibiotics for 3 weeks. And in our case, all the patients have improved. Are there recurrences of extracardiac beats later on? Yes, that is not necessarily an indication that that needs to be treated again with antibiotics. At a personal note, I only indicate antibiotics on early disseminated Lyme disease. When patients come back to me and they request long-term antibiotic treatment, that is not a cardiology, it's not part of a job of a cardiologist. The patient is referred to an infectious disease doctor or to their family doctor. So if I answer specifically the first part of the question, yes, extra beats can be a manifestation of Lyme carditis. However, doesn't mean that this particular case or every single case of a patient that has had Lyme carditis and repeats palpitations or having extra beats should be treated with antibiotics.
Okay, next. I am dealing with erratic BP. The more active I am, my BP is normal. I have Lyme and Bartonella as well as toxic mold syndrome. What could be causing this? ECG was normal, 54 years old.
John, there is a condition called POTS, which is postural orthostatic tachycardia syndrome, POTS. And POTS associated with Lyme has been deeply studied. Experts in the US, Johns Hopkins, search them and look into POTS and Lyme disease and allow your doctors to determine if you should be referred for investigation of POTS or not.
Next is from Andrew. For those with late disseminated Lyme carditis, is 3 weeks of doxy enough to cure it?
Andrew, there's no answer. It's a great question. So I am not sure if antibiotics should be part of the treatment or not. At that point of knowledge I am not sure, because if the condition is triggered by autoimmune response and there is no bacteria in your heart, there's no spirochete, then the antibiotic may not be doing anything. However, there is a big interrogation mark to answer that question. And unfortunately, the level of knowledge that we have at the moment does not allow us to recommend something systematically for a suspected late disseminated Lyme carditis. For example, do these patients need a biopsy of the heart to confirm that they have late disseminated Lyme carditis versus other type of cardiomyopathy? We don't know yet.
The next one is from an anonymous attendee. I'm going to go ahead and answer that by saying this session is being recorded, and I do know Dr. Baranchuk discussed symptoms presentation of carditis earlier in the presentation, so you'll receive the link first thing tomorrow morning. Please click the link and rewatch to get all of the information, and there's also additional resources on our website regarding symptom presentation of carditis that we actually developed with Adrian here. So definitely encourage you to look more, and we'll move on from that question. Maura is next. This one seems a little specific. That's going to be up to you, Dr. Baranchuk.
What I could say, Maura, is that 30 years later, having 7,200 PSCs per day is not necessarily a consequence of Lyme disease. And I know that is super hard to hear this. But the truth is that if I am in front of you, I could say the same thing. I'm not sure that your PACs are a consequence of a late disseminated Lyme carditis. So then the treatment or not of the PACs can be regulated even by a cardiologist with no expertise on Lyme disease. Because even if you come back, if you come to see me, I will say, I don't know if those are associated with Lyme disease. And I couldn't give you antibiotics for that. And depending on the percentage of these 7,200, I will discuss doing something versus doing nothing. But that can be done by any cardiologist.
Moving on, we have Brian. Can my dilated aorta and root be related to a Lyme carditis?
Brian, this has not been described to the best of my knowledge. There may be a case report here and there, but I don't know. And I don't have it in the back of my mind as being reported, but it potentially could.
So this is a bit of a segue back to a previous question, but I wanted to put this in the chat for everyone. I know somebody had asked about length of time for antibiotics, especially in chronic cases. I know they're not all specific to carditis presentations, but there's a resource on our website called Lyme Persists, which goes through a long list of studies that outlines why Lyme can persist, and as well as the benefits of longer antibiotic treatments in addressing the persistent symptoms. So I encourage you all to check that out and read more. Like I said, it links out to a lot of different research in the space. So encourage you all to check that out. We are at 6:23 here, so I think we can get a couple more questions in. The next is from an anonymous attendee. Do patients, well, you did already kind of answer that, yes. Patients with
but
carditis.
Just to clarify to this colleague, as what we truly know is early disseminated Lyme carditis, I could say no. POTS is one of manifestations of late disseminated Lyme carditis with implications over the autonomic nervous system. So it's extremely rare, the autonomic nervous system, to fail during the early disseminated phase. The next one is I was
going to say it's a thank you for you, which is well deserved.
Thank you so much to this AA. And Kimberly says, where can we find a link for a handbook? Could not get a shot. Okay, so just put in Google, put Lyme carditis from A to Z, and it's going to take you to Amazon or to Springer. Thank you so much.
I'll put that in the chat right now if anybody wants to link out to it. All right. Dr. Baranchuk, I will give you free reign here if you want to scroll through the rest of the questions, see if any are relevant and you'd like to answer them before we close for the evening.
Sam, it's very difficult to answer your question with the data provided. I don't see a reason for you to be admitted. But again, this is not the area where I feel comfortable answering questions that are too directed to specific treatment, because there is a liability. I say no, then something happens and someone goes and said, Dr. Baranchuk told me that. So I apologize for that. The only thing I'm doing is protecting me, my career, and my family. And I know that there's obviously no malintention, but please accept my partial response. Do you have preferred labs, or are any of the reputable labs acceptable? I have no experience. In Canada, we send it to national labs, and I do know that several Canadians that have tested for Lyme negative, end up going outside of Canada and coming back with a positive result. This is a little bit outside my area of interest in this condition, but this is something that I heard several times.
We have
Can
a
blood from
resource on our
Europe
website.
can send to you? No. From Europe or from any other place, Susanna, please don't send me blood. I have enough with my own. No, without joking, Susanna, I don't do any sort of testing. I don't have a lab. I'm just a cardiologist that goes to his clinic and do his job. I have nothing to do with lab testing. To what extent would the screening miss a woman with late-stage Lyme disease who develop AV block or other manifestations of Lyme carditis? It's impossible to answer. What we say is that the prevalence of reported cases is male 3-to-1, but to what extent, I don't know. Even if you ask me to what extent a woman with chest pain and having a cardiac infarct is missed, I couldn't give you a number, but I can tell you that the disrespect of gender segregation in the mind of some healthcare providers is still a problem that we need to fight. And how do we fight it? With education. We need to educate. We need to advocate for women. We need to advocate for women in cardiovascular care. Boy, Mayamot, do they people provoke? That I'm going to pass from Fabian because I am unable to read or understand what he means there. Sorry, Fabian. Can high blood pressure be associated with Lyme carditis? No, I don't think so. I don't see a direct relationship. Remember that sometimes when we put the heart rate too low, there's two ways to respond. One is a counter reaction that triggers high blood pressure. The other one is so low and so persistent that the blood pressure starts going down, and this is when we have problems. I experienced total hearing loss with ceftriaxone treatment for another condition unrelated to Lyme. What other antibiotics could have similar success rate? That is not for Adrian. I'm sorry. I'm a cardiologist. Is there a clinic where I can consult Dr. Adrian personally? Yes, the waiting time is 1 year. I am in Kingston, Ontario, in Canada, and I occasionally see patients that are coming because they are desperate. But what we try to do is to help through websites like the one that Noah was explaining through Project Lyme to give you care closer to where you are, because there are people that understand this and can help you without you having to spend several amount of dollars traveling all around. Could you explain in a bit more detail on how to diagnose atrioventricular block? Very quickly, Sharon. You do an ECG, and the fellow, the resident that is looking at that ECG can diagnose atrioventricular block. This is something that they learn in the first few years of med school. You don't need a super expert for that. What you need is an ECG.
Dr.
I have been diagnosed.
We're
okay.
coming up on 6:30 here. I think
my apologies
there's so many questions to answer. I personally am interested in finishing up with my day. If you do you want to stay on longer, or are that's
to be
really
absolutely honest, I have few minutes to engage into my next Zoom before finally being able to go for supper.
Sure.
So I have to apologize, but I feel so happy to have been able to answer at least few of the questions.
Yes, and thank you so much, Adrian, Dr. Baranchuk, for all of your help today, and for all of the attendees for registering and coming in to join us for this session. As I mentioned, it's recorded, so you'll receive a link to this tomorrow morning. Thank you so much, and have a great rest of your evening, Adrian.
Thank you, Noah. Thank you to Project Lyme. Thank you to iLads. And more importantly, thank you to these 160 people that after 1 hour of chit-chatting are still there And for those that have put their questions, we are learning together. Remember, there is no geniuses here. It's a continuous learning process that never ends. And the best that I can do for my communities and for my trainees is to show them with example that we're permanently learning. So do not give up, stay well, and as we know more, we will be able to do more and to improve the health of the communities. Thank you so much, Noah.
Thank you. Bye-bye.